you're in trouble. Now you're really going to hear me. Good morning. My name is Nick Machino. I'm director of the county's Health and Human Service Agency. And I've heard several people say it's a good day. It is a great day here for the groundbreaking of the Tri-City Psychiatric Health Facility. Sometimes referred to as the great signs as you look coming to parking, Tri-City Puff. That's what we call it, Tri-City Puff, because there's a cool ring to it. It is really an exciting time for not just North County, not just the Tri-City in North County, but the entire county region. This is the latest installment of the future of behavioral health care in our county. And it's a key piece of the North County mental health safety net. I want to begin by acknowledging the importance of this day, never forgetting that we're going to have a wonderful facility, but we always have to be reminded it's what happens inside the facility that's really the transformation. So I want to recognize the psychiatrists, the physicians. I know Dr. Gene's here and his great physicians. Our nurses, some of who I've met, our social workers, our maintenance staff at the Tri-City for their steadfast commitment to serving San Diegans experiencing mental health crisis. To you, we all salute you. It's going to be this team that will make the Puff its success in saving lives. Let's give them a round of applause, in fact. That's right. And to recognize the importance of this Tri-City Puff, we have the leaders who helped make it happen. With us today is Board of Supervisors Chair Nathan Fletcher, who has been absolutely 100% committed to improving our behavioral health continuum of care throughout the entire county. Also with him is Board of Supervisor Jim Desmond, who has supported several North County services dedicated to behavioral health. From the Tri-City Health District, we have Chair Rocky Chavez, CEO Steve Deitlin, and Chief Medical Officer Dr. Gene Ma. Each of them were key to making this Puff a reality. Special thanks to Oceanside Mayor Esther Sanchez, who is a big supporter of this project, and many projects, in fact, in partnership with her city and the county. All of them will be speaking, so I don't want to steal their lines, but each of them have been and will remain extremely important to this project. Also with us today, my boss, our Chief Administrative Officer, Helen Robbins-Meyer, Dr. Luke Bergman, the Director of Behavioral Health Services that's leading the way for the nation here in San Diego with our behavioral health continuum care, and Steve Schmidt and our General Services team. They have worked tirelessly in helping make this facility happen. To all of you, immense thanks. And to all the other VIPs, and there are many, the chambers, to other board members, the supporters who have helped support this facility, make it happen. Thank you as well. As I mentioned, San Diego County is very fortunate to have a board of supervisors and leadership from the top who are committed to advancing behavioral health. Now, the development of this Tri-City Puff did not come easy. It required a tremendous amount of commitment, many conversations, and support from all parties. I said it wasn't easy because the closure of Tri-City's acute beds in 2018 really challenged not just the Tri-City region, but the entire county region. In response, the county stepped up with 3 crisis stabilization units in Oceanside, Vista, and Escondido. We also launched the mobile crisis response teams, but that's not the same as an acute care facility. Ultimately, Supervisor Desmond, with support by the entire County Board of Supervisors, led the development of a partnership between the County of San Diego and the Tri-City Health District to develop and construct a 16-bed psychiatric health facility on vacant land owned by Tri-City. Compromise was required on all sides. The cost of the project is being shared by the County and Tri-City. The county will spend upfront the funds necessary to build the facility, ultimately with a 30-year commitment to this unique cost-sharing partnership to provide critical psychiatric health services to thousands of San Diegans over the next 3 decades. It's a win-win situation, especially for the residents of Oceanside and the entire North County. Now, here to tell you more about our journey to rewriting how San Diego County provides behavioral health services is our County Board Chair, Nathan Fletcher.
Thank you, Nick, and good morning. I want to thank Supervisor Desmond for welcoming us up to your district, and Mayor Sanchez. It's wonderful to be here, and to everyone who's a part of Tri-City. It was about 4 years ago, almost 4 years ago, I got elected to the Board of Supervisors, and I made clear my highest priority was issues of behavioral health, mental health, and substance abuse treatment. And from that time until today, our county has driven unprecedented investments in investing in the lives of folks who need care. The reality is, for far too long in America, we have not treated issues of mental health the same as we treat issues of physical health. We've not met people where they are in terms of providing addiction services that we know can actually save their life and give them a chance to invest in the future moving forward. If everyone sitting here right now broke your leg as a society, we would have no problem getting you in. We'd get you an x-ray, a cast, a pair of crutches. You'd be able to go on with your day. But if everyone here right now needed mental health treatment or needed substance abuse treatment, it wouldn't be available. Because societally, over decades, we have never funded, staffed, cited, nor prioritized an investment in mental health and substance abuse the same way we have other things, and that's wrong. And the reality is, every single one of us knows somebody whose lives have been impacted. Every one of us has someone in our life who has suffered from addiction or mental health, or perhaps both, given the co-occurring rates and how high they are. And that compels us to try and do things differently than we've done them in the past. And being here today is another step in our county's efforts to partner with our healthcare systems, to partner with our providers, to provide a better way for behavioral health services, and to help ensure that those families out there and those individuals out there who want to live a life of purpose and meaning and simply need the availability of services to treat the conditions that they have, this is a strong step forward. I don't believe there's any difference in someone who suffers from depression than someone who suffers from high blood pressure. I don't think there's any difference in someone who suffers from bipolar than someone who is diabetic. And the way that we show that is true is what we're doing here today. It's where we invest our money. It's where we invest our priorities. It's where we have difficult conversations to figure out a way to get there. And I think that it is another powerful step. And Nick outlined a lot of things that we've been doing at the county. But the reality is, we can't do it alone. We need partners. Steve, we need you and your board and your team. And we're grateful that we're here today. And we are grateful that we are moving forward. Breaking ground on this new 16-bed inpatient facility, again, helps provide that foundation we need. Now, we know in the ideal world, we don't want people to go to such a high level of acuity that they need an inpatient psych bed. And so we will continue to work on crisis stabilization units. We were out with the mayor launching one of those right here in Oceanside. Our mobile crisis response team, our community care, our care coordination, all of those efforts are designed, but we need this foundation, and we need it in this part of North County. And so today we take a really positive step forward, and it was a long road to get here. But none of that matters. We're here. We're breaking ground. We're moving forward. And I want to echo something else Nick said. I want to say a special thank you to all the workers who do the work in these facilities. This is difficult work. It's hard work. You got to have a tremendous heart. You've got to have great compassion. You have to be well trained and have good skill. You have to have exceeding patience. And so for all of the nurses and the techs and the psychiatrists and psychologists, for all the peer support specialists and the clinicians at all of the various levels who do this difficult work, as a group today, we say thank you. We say thank you for what you do, because at the end of the day, a building doesn't take care of anybody. A bed by itself doesn't help anybody. It is the individuals who will staff this facility that will make a difference in the lives of folks. And for each and every one of you, we give you our eternal thanks and appreciation. Tremendous thank you for what you do. I want to thank our county team, Nick, who you heard from, Dr. Bergman, who is every day gets a new major project that we want to launch, and we want to launch it right now, today, faster. Why is it taking so long, Luke? But I really appreciate Luke Bergman, and to our CAO, Helen Robbins-Myers, who has really shepherded through and helped us skillfully guide this significant transition as a board, where we are investing in things we haven't done before, and we're doing it in ways we haven't done before, and we're doing it in a fiscally responsible way. And so again, my eternal gratitude and appreciation to everyone here, the Tri-City team, your board of management. Good to see Rocky there, fellow Marine, and Dr. Ma and everyone who's been a part of it. Today is a really good day, and the partnership that we've established with the city of Oceanside, with our healthcare providers, with the County of San Diego, is a partnership that we're going to need to have moving forward, because this is not the last thing we're going to need to do in order to fulfill the promise that behavioral health is health, and it needs to be treated the same. So thank you all very, very much for all of the work that you've done today, and it's my honor to join you today. Thank you. And now I'd like to welcome my partner, who's been a wonderful partner in all of these efforts, has been there right alongside, really fighting for his district, and I appreciate that tremendously. Please welcome your County Supervisor, Jim Desmond.
Well, thank you, Chair, and thank you, everybody, for being here today. I mean, this is a wonderful day. This is a day that we've long been waiting for. And I also want to thank Helen Robbins-Meyer and Dr. Luke and Dr. Nick and all the board members that are here today that made this all happen. It's about finding solutions. And in North County, we're leading the way. We've actually got a lot done in North County. If somebody asked me, what was your proudest moment at being a county supervisor? And I would say it's bringing the behavioral health services that we've been able to bring to North County. And this is the keystone of it happening here today. Well, when we first came to office, Nathan and I were elected at the same time, and behavioral health was, front of mind. While Nathan and I don't agree on everything, we do agree, though, that behavioral health throughout the county has to be taken care of. And it was in my first few months. We had the suspension just happened just prior to the election of the beds here at Tri-City Hospital. And I got together. I had several meetings. I had several meetings with Steve and his board members, with Diane from Palomar Health and their board members, and from many of the council members in Vista and Oceanside. And we all pieced together and says, what can we do to fix this? We have a desert here of behavioral health services in North County. What can we do to get this happening? And Steve says, well, how about $15 million? In getting the money to build more psychiatric beds here at Palomar Health. Here at Tri-City Hospital. Sorry about that. And I thought, well, this is a big lift. I'm only 3 or 4 months into my term as county supervisor, but I went to the board and I stumbled a little bit the first attempt, but we were able to get, I think, $17 million at the time with the help of Dr. Luke and Nick Mascione. Then this was 3.5 years ago. I was hoping we'd be at this groundbreaking 3 years ago myself, but that was 3.5 years ago, and we got the dollars for it. And it's a great partnership with the county. The county is going to actually build the facility. The Tri-City Hospital and your staff, everybody here, is going to operate the facility. And I think after 50 years, you get it for $1. Is that it? Huh? 30 years? 20 years? No, okay. No, But anyway, it's just a great partnership, and throughout that, we also were able to get crisis stabilization units here in North County as well. We opened up one in Vista, and I know Deputy Mayor John Franklin is here. Where's John? There you are. Is any other Vista council members here? That was a lift. That was a heavy lift working with Vista. They initially were hesitant to say, we offer enough services here, happy to have Carlsbad take it over, something like that. But we persisted, and we have Ray Pearson here as well from Carlsbad. But it was a collaborative effort. And then I met with Oceanside with the mayor, Esther Sanchez, with Peter Weiss back here. I also see Corey Jensen is here. Who else? Ryan Keim is here. And we did it. We all the politicians, we pulled together and said, what can we do to help? And so it was really a great learning experience, and the fact that we were able to get, now it's up to $20 million because it's taken so long, for this facility to be built. And we also, as Nick and Nathan had mentioned, are the crisis stabilization units. We have 3. We opened one up in Vista, and we opened one up in Oceanside. Brand new facilities that are community-based, and we're getting the help that people need. We also helped the Palomar Health. They had kind of a half of a crisis stabilization unit, and we funded them for the full bill there. So I'm very proud to have this happen, and that all of the people here at Tri-City are it's not just the county, it's not just all the politicians, but it's everybody here in the board at Tri-City as well, making this all happen. So one of the other things that we brought to North County is One Safe Place. And this was actually District Attorney Summer Steffen brought this forward, and this is a place for people who are victims of domestic violence or people who are victims of sex trafficking or elder abuse or child abuse. We have one safe place opening up here. And out of the 5, is there only 5 crisis stabilization units now? How many do we have? Huh? We have 6. 3 of them are up here in North County along the 78 corridor. So we've done a phenomenal, I thank the rest of the board for helping us in this effort, and the fact that we were able to make this happen today is good. I'm not even using my script here, so sorry staff for putting this together, but nearly 40% of the population of San Diego County live in North County, and the psychiatric health facility is a true winner for us all. So I want to commend Tri-City Board for stepping up. I want to commend everybody here who's part of this. Happy to look forward in the next term to if we can continue in this effort and continue to bring the health and the services people need to North County. I'm proud to be a part of that, proud to be part of this team, and proud to be of everybody that's here working today. Thank you very much. Let's see. Rocky Chavez on your Tri-City Board of Directors. I'm going to bring him up. Rocky, welcome. All right. Thank you.
Well, it is a great day to be at Tri-City Medical. I think as the chairman of the board, it's important to recognize actually how things work at Tri-City. And the way they work is by the board. So I'd like to recognize my board. I have Dr. Chai right here. Raise your hand. New board of director, Marvin Mizell. By the way, he just got on, hit the ground running. He brings a great depth to the community. We don't hold this against him, but he's a lawyer. We have Adela Sanchez, who is one of my favorite stars. She's from Vista, actively involved in the community, actually a nurse herself. She's been steadfast on this whole issue, and that's Adele. George Coulter, a Marine who has been working at Tri-City before and actually worked in the Tri-City in the mental health area back when he was an employee here. A very strong board member. He's one of these people you go to and say, how did we do this 30 years ago? And he can tell you, and that's George. And then we have Gigi Gleason. Anybody who knows anything about Oceanside knows that Gigi's involved in everything that's happening. She's the chairman of the Boys and Girls Club, one of my favorites for helping children, and just an outstanding board member. That's Gigi. It's a famous comment among the Marine Corps that we stand on the shoulders of those before us. And in the case of Tri-City, the gentleman who has been at Tri-City literally for decades, and this was a big issue to him, and that's past board chair a number of times, Larry Shalleck. And also I'd like to recognize that the person who went to Sacramento and leveraged the Senate committees for the funding of this to call down to the county was Leanne Grass. She has moved on to Georgia, but she was a very instrumental leader in the previous board chair. So, Leanne, if you're watching this, we love you and we miss you. So. Now I won't go through the spokes of healthcare because I think the other speakers did that. But I'd like to share with you a story. Maybe some of you guys know this man's name, Darrell Steinberg. He was a senator up in Sacramento. Now he's the mayor of Sacramento. It was in 2012, we were doing in Sacramento a behavioral health issue. And so he was out there trying to make an issue of this funding throughout the state. And generally when they do these, Republican and Democrats go to their corners. And I showed up at the event, and Darrell said, what are you doing here? Because I was a new assembly member. And I said, Darrell, I'd just like to get up and speak on this issue too. So he let me speak, and I thought I'd share with you a little bit about this. You know, it was in 2019, my son, who was a state champion wrestler, who had an appointment to the Coast Guard Academy. He was in his 3rd year when he had his first break and became a schizophrenic. And it was at Tri-City Hospital that took care of him in their center here to start him on the way of recovery. Now, because of the support that Tri-City gave and because of the support that the family had, we were able to maintain a safe environment for him so that he stayed on his meds. He's 44 years old now, and he takes all his meds by himself and lives by himself. He went back to college and got a college degree. And if you go anything to the Mission San Luis Rey, the Catholic Church, everybody knows Sage. He's a previous Grand Knight at the Mission San Luis Rey and the Knights of Columbus. Now I ask you, how does somebody who is schizophrenic, who we normally see on the streets homeless, and if you really want to deal with homeless, Nathan, it's mental health. How do we move somebody from that to be a leader in his church? It's a continuum of care and involvement. And I would say it's family, and it's also Social Security. There's a lot of things out there. But too many times when I went to NAMI and I talked to people, they didn't understand that. Because families don't understand mental health. Because they understand diabetes, they understand a stroke, a heart attack, but they don't understand mental health. And I submit to you, mental health is much more debilitating than those. And it strikes them at a very young age. But it doesn't mean it's over. With facilities like this, and then following on with the continuum of care, these people can go out and live productive lives just like my son. And if you met him today and you played a game of cards with him, he'd probably beat your butt because he's an applied mathematician. But the reason he's successful is because there was that structure there for him. That's what we need to do in this county. That's what we need to do to make things right. And when I finished that story with Daryl Steinberg, he came up and he says, Rocky, you and I are going on a tour. And we started talking about that. And it was one of the things that always crossed over between the Democrats and the Republicans up in Sacramento was on this one issue. So I'm glad to see that the county of San Diego finally came through with this thing. 4 years ago when I ran for the board, I said, I'm going to go get that thing taken care of. Well, I'm up for election again 4 years later, and no one's running against me. I'm unopposed, so I guess I'm going to win. But this facility's coming. But I want you to hear this message. It's not just this facility. It's a continuum of care and how we build that, all those spokes in the wheel, so that all these young children are going to be having this system maybe 2 or 3 or 4 years from now. They'll have the same sort of results as my son did. Thank you very much.
Well, there's a lesson in learning who not to follow. Heard a lot of things this morning. I mean, this is a great day. It's an exciting day. I want to reiterate a few things and have a few comments, but just to really recognize healthcare workers. I mean, they're special people.
Yeah, you have the Rocky mic.
Okay, appropriately adjusted there. You know, they're special people. So, and a lot of them are here today, but day in and day out, they're here. They're here because they have big hearts and they're serving the patients. They're doing what they need to do to help our community, and they don't always get that thanks. We've just gone through a pandemic, and I just really want to take a moment and thank them again. A lot of them are out here, but also our first responders, police, fire, everybody that's been supportive of this project as well. Can we just take a moment and give them a hand? And thank you. You know, events like this only happen through community partnership and collaboration. You've heard that from some of the previous speakers. You know, mental health has been central to Tri-City's vision and services and mission for decades. Safety, quality, positive patient clinical outcomes remain paramount for services provided for our community. We're owned, managed, and governed by this community. You see the board members here in support today. federal safety regulations for environment of care led to the suspension of Tri-City's inpatient mental health unit, as you all know. But what didn't change is our steadfast commitment to the pursuit of long-term, sustainable mental health solutions for our community. Again, long-term, sustainable mental health solutions. We continue to provide robust intensive outpatient mental health services in North County and did so throughout the pandemic. Our focus has remained on improving care coordination and service to patients in our community, not just simply replacing inpatient beds. That's not what this is about. Today we break ground on a project to build a new 16-bed inpatient psychiatric health facility right here on Tri-Cities campus in partnership and collaboration with the County of San Diego. It's an exciting day indeed. This project is part of a greater vision to improve patient care and clinical outcomes through care coordination, community-based crisis stabilization units. And you've heard about those crisis stabilization units. This is important. This model provides the opportunity to improve the overall continuum and reduce recidivism in and out of emergency rooms. And it's led by the community, individuals for the care they need, when they need it, in the appropriate setting to improve long-term wellness of our community. And that's important. We want to focus on the long-term wellness, not just treating something and have it repeat over and over and over. An exciting project like this to improve wellness, mental wellness in our community doesn't happen by accident, and it doesn't happen in a vacuum. It takes true collaboration. It takes countless hours with more community stakeholders and supporters than I could possibly mention here today. The Tri-City Healthcare District Board of Directors, current and past, has remained steadfast in unanimous support of this project. Many of them are here with us today. The County Board of Supervisors have unanimously supported this project, led by our representative, Supervisor Jim Desmond, who you heard from, of course, Chair Nathan Fletcher, who's been a champion of mental health projects, here with us today. The three cities of Oceanside, Vista, and Carlsbad have all supported this project. The chambers of all three cities have supported this project. The Oceanside Planning Commission unanimously supports this project. This is a project that's truly there to benefit the health and wellness of our community. The county staff, who you heard from some of them today, but more than I can possibly mention, but I do want to call out Dr. Luke Bergman. I do want to call out Nick Mascione, who you heard from today, and also obviously the support of Helen Robbins-Meyer. So the county has really worked with us on this project. It is a true collaboration. It's a partnership. This would not have happened without all the parties coming together and all the support from our community. And of course, the amazing Tri-City team, just a fantastic team to work with, who's been here day in, day out, moving forward, making sure that we are taking care of our community with the absolute best health and wellness care possible right here in North County in your community. And so many more stakeholders. I see everyone out here today that supported this project, and really it's really an exciting day. Thank you to all who work collaboratively in partnership with Tri-City to improve the health and wellness in our community. We're in deep gratitude for everyone's support. Like I said, this doesn't happen by accident. It takes true collaboration, and we've seen that. And with that, I want to say, let's break ground on this project. Thank you, and I'd like to introduce Dr. Jean Ma, the Chief Medical Officer of Tri-City.
Thank you, Steve. I'm gonna go Rocky Mike. So I had that moment where I realized everything I was going to say. Many people ahead of me said it 10 times more eloquently, so out went that idea. But I actually do want to focus on something that really kind of struck me as I was walking up here, and it's the symbolism of today. Seeing those shovels behind me, it really, and not to mention, somebody mentioned that for the first time in weeks, the sun is out. But it really is a new day, and I think my message is one of gratitude. As a practicing emergency physician here in San Diego now for 22 years, I've seen the devastating impact it has, mental health has on lives and families, and the lack of resources in many ways. And this is not a San Diego issue. This is a nationwide crisis, and I think crisis can't be underlined enough. But the symbolism here is really, truly staggering. I can't tell you, I don't go a shift in the ER without having to address an issue for a family member or a patient that is truly in crisis. And again, Board Chair Fletcher really alluded to it really well. It may not be a broken bone, and yet what we have are literally, it feels like at times, Band-Aids for these families. And these individuals are equally broken. They're devastated, and their families are too. And so today, these shovels represent more than the literal than the literal groundbreaking. They truly are groundbreaking in the sense that what this community, as a result of the leadership, and I won't begin to start with names because I'm terrible with names and I'll forget, but from City of Oceanside to the county, to our HHS leadership, to our elected board members, to our district board, every single one, it's more than just words. This is a commitment on the part of this county to really to create an innovative model in their care continuum that changes the resources that we as providers can provide. And the hope, those shovels represent hope. They represent a new day, and this model is truly groundbreaking. And so from the bottom of my heart, for all the providers, I thank you for being here and for being so supportive and doing something that challenges our notions and says enough is enough. Thank you very, very much.
Thank you, Dr. Ma. Your leadership has been tremendous. You know, we have one last speaker because you always need the mayor's support in your city. And, you know, there are places where you don't always have the mayor stepping up to want to help. You got places that may not even be supportive of efforts like this, be it people that are experiencing mental health challenges, the homeless, vulnerable San Diegans. But not with this mayor. Our Oceanside Mayor, S. Sanchez, says, what can we do more? And how do we support? And has been a terrific supporter in this project. Mayor Sanchez.
Good morning, and as you can imagine, this project has been incredibly critical for the citizens and the city of Oceanside. We do have Deputy Mayor Ryan Keim, Council members Peter Weiss and Corey Jensen here, but we also have Captain Adam Nolan here stepping in for our Chief Armijo, and our City Manager, Jonathan Borrego. When this happened, we were surprised. We were taken by surprise, this decision to close. And I found out through some of the workers here at the hospital, through CNA, the California Nurses Association, SEIU UHW, the healthcare workers. We were all kind of taken by surprise. So that was kind of a gap in the network here, and it hit us immediately because, as you probably can imagine, our public safety has to transport. And before the unit was closed, the mental health unit was closed 18 beds, it would take between 90 minutes to almost 3 hours taking officers out of service, off the streets. And so we knew, and also the families. We're talking about really, really critical care issues. And so what I am really, really so happy to be able to celebrate today about is that people stepped up, not just at the county level, so happy about that, but also at the state level. I want to say one name that hasn't been mentioned, that's Assembly Member Tasha Borner-Horvath, who really came down and said, look, we got to do something. Obviously, the cities wanted to do something. We were in constant contact with the boards. I think Rocky Chavez, I think we were talking and trying to find out, well, what can we do? We don't have a plan to replace. To take these critical patients out to having to take them all the way to San Diego, putting us out for maybe even up to 5 hours, our public safety, which just was not acceptable. So I want to say thank you so much to the county, to Chair Nathan Fletcher for your leadership. Also, Board of Supervisors Jim Desmond, but also, and as I said, Tasha, but also the CNA members, the nurses, the healthcare workers, admin, administrative staff, because we finally did come together, and that is what I would especially like to celebrate today, is that we do have a better networking of working together. We understand that this started off as an infrastructure issue that we were unaware of. A very, very critical, our only community hospital here in Oceanside, right? Tri-City, Oceanside, Vista, Carlsbad. So this is what I'm really, really happy about, that we have all come together, that hopefully we'll avoid these kind of crises, and because it's going to open in 2023, and we're going to be so very happy when that happens. I want to say that, share an experience that I've had in the past, and that is I was a deputy public defender in my other life, 20 years. And one of the things I got to do was be assigned to the mental health care unit. Tri-City Hospital was where I would go when the conservatorships were up. As you know, conservatorships are 1 year, and because of the possibility of losing certain rights, it is of constitutional nature. You have a right to attorney, you have a right to a trial by jury within 30 days. So I got to see my clients at Tri-City Hospital and saw the difference that care could do to a person who is potentially gotten off their meds and needs that help. Because at that point, they don't need meds, they think, right? And the other things, I'm not going to even pretend to be an expert here, but the change within 30 days, and that is what 24/7, that kind of critical care, so important to try to help people get back on their feet and continue their lives. So thank you so much to everyone involved, everyone. There was a lot of activity when this first happened to get the focus on this very, very critical issue. And now that has happened, we've just gone in a very, very positive direction. And I look forward to continuing to work with the county, the state, and Tri-City Hospital. Thank you very much.
Thank you, Mayor Sanchez. You heard the mayor. Project going to be done by next year. So Turner Construction, good luck. Let's make sure that happens. We wish it was by next year, but I know Turner is going to be full throttle in getting this up because it is about saving lives. I want to thank all the speakers who have spoken, but I want to thank all of you coming out. It's been repeatedly said, it requires all of us to make this happen, and you being here and supporting means a lot. We are going to be saving lives here. No doubt. And this is not the one and end. We have so many more projects, as Chair Fletcher talked about, that Luke Bergman's leading the way, that we are standing up throughout our entire county for our continued care. We are truly blessed in San Diego and leading the way, not only in our state and the nation, of really advancing behavioral health care for San Diegans. I'd like to now ask all of our speakers and our Chief Administrative Officer, Helen Robbins-Meyer, to join me behind the podium for a photo. There will be additional, don't feel bad, there will be additional photo opportunities for anyone who wants to turn the dirt. But we're going to ask our speakers and CAO to grab a shovel in the digging area. We're going to pose for a photo, as well as any of the speakers are available for one-on-one interviews afterwards. Thank you all for coming out this morning. Okay, thanks.
I don't have one.
How many have you done?
Yeah, you got a rocky. Small one.
Far more than that.
All right, Rocky.
How you doing, buddy?
Could have a Navy guy between you Marines here.
My name, but-
Sandals.
You guys say
Really dumb.
All right, we ready? One. Get your shovel full. Toss it up here on three.
Wait, before you do, everyone, please look this way. We'll take one before you
lift it up.
shovel.
Lift it
Okay, in 3, 2, 1, and now shovel.
All right. All right, Tri-City.